can't have a system that works better for the insurance companies than it does for the American people. We need to give families and businesses more control over their own health insurance, and that's why we need to pass health care reform. Not next year, not 5 years from now, not 10 years from now, but now.
Now, right? That was 2010, President Obama, when he was calling for passage of the health care law and attacking those big insurance companies and all of the profits that they make as part of the insurance debacle that needed to be fixed. And now as Obamacare starts to get closer to that October start date, we're learning today that the administration has hit another bump. They're going to delay yet another part of this law. There was supposed to be a limit to your out-of-pocket expenses, but now you're going to pay more, according to what we're learning today, before your insurance starts to kick in. That deductible goes a little bit higher. The out-of-pocket expenses, I should say. This latest delay could actually boost the profits of the insurance companies that President Obama attacked in that soundbite that you heard back in 2010. So what's going on with this? Let's bring in our panel today. Leslie Marshall is a syndicated radio talk show host, and Rich Lowry is the editor of the National Review and author of Lincoln Unbound. Both are wonderful Fox News contributors. Welcome to you both. Good to have you here.
Good morning.
So, good morning. Leslie, you say you're not concerned about this.
Well, certainly I don't want anybody having to pay more, but a lot of the research that I have shown is a lot of the analysis was done in years like 2009, 2010. Remember, these are companies, much like many people in America, that thought, A, this legislation wouldn't be passed, and B, at the end of the day, in the 11th hour, the court would say this mandate is unconstitutional. Neither of those happened. At the end of the day, 2015, to have that cap is better than nothing at all. And as a matter of fact, Rich and others on the right helped to make the point for Obamacare, for the Affordable Care Act, because without it at all in place, then these increases and the not even glass ceiling, no ceiling for insurance companies would be there way beyond 2014. So do I like anybody having to pay more for 1 year? No, but you do have to have systems in place. And obviously, not every insurance company and their pharmaceutical wing are in sync currently, and they have to be in order to run this properly.
You know, one of the sort of big issues here in terms of the big picture is that the health insurance companies were, supposed to be the bad guy in this equation. They were the ones who were running up the costs, and I'm sure, and there's some truth to that when you look at the large picture of healthcare. But they were sort of, the bad guy. Then you had those big corporations, those, horrible companies. They were the other big bad guys. Congress isn't too popular, right? So far you've gotten exceptions for companies, exceptions for health insurance companies as well. And Congress, who doesn't have to take part in this, is one of the big issues that's on the forefront right now. It's, good enough for us, but not good enough for them, apparently. And it makes it look like, we're sort of, this whole thing is a bit upside down, Rich.
Yeah, clearly, if you are big and politically connected, you can get your delay, you can get your waiver, you can get your exemption. But if you're an individual, you're not. And Martha, I just think this builds the case for delaying the law entirely. It clearly isn't ready for prime time. Leslie mentions technical systems. Well, that's another word for whether you know how to actually make this thing work, and clearly they don't. And also, it's more fodder, I think, for the case that the individual mandate certainly should be delayed. Because why do you give big employers a break? Why do you give insurance companies a break, but you don't give individuals a break?
Yeah, Leslie, it does feel like the empowered in this equation are able to work out deals for themselves that the little guy is not getting. And we were told by the president that that's who he was really looking out for in all of this.
Well, it's funny. I swear, I didn't know yesterday we'd be talking about this today. And in my purse out there, I have 3 letters from Blue Cross, my insurance company, for my company, my husband's company, and for my own family, my kids and I. And we're getting reimbursement checks. And it even says because of the Affordable Care Act. The insurance companies are the problem in medicine. And I say that as an owner of a medical center and married to a doctor, and I get grief for that, mentioning that all the time. But the reason I mention that is the individuals are the main problem in America with our history of how we have operated as patients in not having prevention and waiting until your bone is sticking out of your leg instead of seeing the doctor all along when you're having pain. That is what the problem is. It's the insurance companies that set the rates. It's the insurance companies that set the rates for reimbursement. When you're at a hospital and you're getting charged $20 for a Tylenol, that's not a doctor, that's not even a hospital setting that rate. That's because of the insurance companies. So the insurance companies are the big bad guys, but unfortunately, in this case, you have to work with them when you're overhauling a system. And historically, Social Security has had almost a dozen changes since its implementation till today in 2013.
That's
Leslie,
one of the other
what we're
big
seeing-
arguments
what we're
here,
seeing-
Rich, is that it's all just the kinks that have to be worked out in any new business or any new car or piece of equipment, according to the president.
Well, I mean, the employer mandate was a big deal, and liberals complain about Republicans supposedly sabotaging the law. What did Republicans do to sabotage the employer mandate? What have they done to sabotage the exchange that's being set up in Oregon, a state obviously run by liberal Democrats, but can't get it together because this law is so hideously complicated? I'm glad Leslie is getting refund checks, but all around the country, we're getting these stories about this rate shock where people are going to have to pay more insurance premiums because of this law, despite the president every single day when he was arguing for this before it passed, and even now, the other day in his press conference, saying that insurance is going to be significantly cheaper by implication for everyone. That is not true. This thing was sold under false pretenses. It's a train wreck in its implementation, and it should be repealed, and we should go to a more sensible system.
All right, guys, we'll pick this up another time. Thank you very much. Rich Lowry, Leslie Marshall, good to see you both.
Thank you.